And Judy, tell me what it is you do in the community.
Well, I'm the Assistant Superintendent of Wolfe County School District.
Okay.
I wear many hats. I assist with the superintendent on various issues, from transportation to food service to teachers to doing actual evaluation of administrators as well as teachers. I do the federal programs. I'm also director of the family resource for the district. I'm trying to think what all I do. I assist with transportation if they need it. I've said I carry a radio at home with me at night. I also
You're
have
busy.
a telephone.
You're on the call 24/7. It sounds like.
Like I said, I have many hats.
Yeah.
I do PD. I couldn't start to tell you all the jobs I
Okay.
do.
So, and are you from this county?
Yes, I am.
Born and raised here?
I was born and raised here.
All right. So you really know this county well.
I figure I would. Yeah, I think I would.
And are well connected with people.
Yes.
Well, I'm so happy that you're here because I think the things that you'll be able to share with us will be really useful.
I hope
So let me start with this. If you hear the word diabetes, what do you think about? What's it comes to your mind?
Well, I know it's a disease that affects how the body receives insulin. The body can either have too much or not enough insulin. It's a problem with the disorder of taking care of the insulin in the body that helps us grow and have energy. I guess it's the best definition I would say.
Okay, yeah, and we're concerned because the number of people with type 1 diabetes, that's the ones who are insulin dependent and get it as children, that's pretty much steady. But the number of people with type 2 is like
increase.
Growing up like a mountain.
Yes, it is.
You know, and unfortunately, Wolfe County is one of the highest, one of the unhealthiest counties in the nation, and
yes, it is.
And
We're
certainly
very well
in Kentucky.
aware of that.
And so that's what this is about. We're trying to figure out ways to really promote the health of people in rural counties. One of the things that's interesting about Wolfe County, it's a very small county.
Yes.
Well, not land-wise, but people, numbers of people. So it's hard to get a lot of extra money sometimes in a small county.
We don't generate much money.
Yeah, so that creates a different kind of problem. So let's start a little bit with talking about your experience with type 2 diabetes.
Well, my grandmother had diabetes. She had her legs removed. I've had several aunts that had diabetes. I've got several cousins that have diabetes. And I know it's a very serious problem. I have a very good friend that has diabetes. And, I know it's something other that can kill you. It can cause you to have coma. It can cause high blood pressure. It can cause strokes, kidney failure, just to name a few of the things that, it's very, very serious.
Mm-hmm. And in your family, how are people doing once they have the disease? Are they taking care of themselves?
Well, not all of them did. And I think part of it was not knowing the facts. Old folks, it's hard for them to understand the importance of exercise, eating the fish, fruits and vegetables, and things that will help them maintain their insulin levels.
Mm-hmm.
I think they just flat don't know the facts sometimes. Mm-hmm. And obesity is a major concern. Mm-hmm. I think people in Wolfe County were all a little on the chubby side. And I think it's lack of exercise, lack of knowing the facts and how important exercise and nutrition is.
Now, because you're so involved in the schools, you actually see the children.
Yes.
And so what are you seeing? Are you seeing many overweight?
I'm seeing too much obese children in our school system. I know the superintendent and I, we have worked very hard on trying to revamp the food service. In fact, I just came from our food service director this morning, and she and I talked about the importance of trying to get healthier meals, that type of thing, into our school. We're going to visit another district that is supposed to have a little better program than ours, and we're going to visit and see what they are offering that we're not and how they're funding it, so we can increase our food program to a more healthy start.
Is there an attitude that children won't eat certain things and that they...
I think it is, but I think a whole lot of that, needless to say, comes from the home. People that work, it's very hard to come home, you're tired, and you've got all these little kids to feed, all your work to do, the laundry to do, and a working mom has a really hard time trying to fix good, healthy, nutritious meals. She has to plan ahead because we don't have a local grocery store.
Mm-hmm.
We have to leave the district to have a nice grocery store like Kroger or somewhere like that to get better foods for our families. So that also cuts back, I think, on some of the reasoning that we have obesity in our district.
I was here in the community a few weeks ago, and so I went in your grocery store.
Yes.
What's going on?
Very eye-opening.
It's really frightening almost.
Very frightening. Most of the people here, we shop at the $2 stores, to get food. Of course, there's very limited supply on meats, very limited supply on fish, and then it's probably breaded. It's not that nutritious.
Mm-hmm.
We just don't have one. We're hoping that we're going to get a ShopWise. It's called a Save a Lot,
mm-hmm.
and the whole community is just beside themselves that we could get a Save a Lot.
Mm-hmm. And there's no hope that this particular store is going to...
Well, we hoped that it would, but it hasn't so far.
It's not. So far it hasn't. Okay. One of the things that people talk a lot about is that kids don't get enough exercise at school. What can you share about that?
That's a real problem. Our government has cut back on funding for education. You can read it in the newspapers, you hear it on TV. Our whole country's in turmoil as far as having lots and lots of money to spend anymore. It seems like we don't have it. The superintendent and I just discussed last week on, back even when we were in school, we had PE, arts and humanities, those types of things that we're not able to offer our children now, and that hurts me really bad, that we can't offer those types of things
mm-hmm.
in the 21st century. That we don't have that kind of option because we don't have dollars to fund it.
Mm-hmm.
Our principals are very good about being innovative. Maybe they'll ask one of their special ed teachers to do a period of PE. The school teachers in general will take the little ones out, for recess and try to do some things like kickball and dodgeball and baseball and those types of things. That does help, but it's still not a good program as far as actually coming out and having an hour of physical activity
mm-hmm.
weekly.
Mm-hmm.
And I regret that we're not able to offer that to our children. I have a grandchild that's in our system, so it really hurts me to see that we can't afford those types of programs for our children due to lack of funding.
Now, again, when I was here a few weeks ago, I went over to the elementary school
mm-hmm.
here. It's beautiful.
Very beautiful, very proud of
Beautiful, beautiful. So I didn't go in, but I just drove around up there on the hill.
Mm-hmm.
And I was because a lot of times people say, well, there's no place to walk.
We have places to walk there. Mm-hmm.
But
actually, we do probably at both of our elementary schools. I know I was principal at Red River Valley, and we also had a little outdoor classroom and a big playground, that you could walk and do all kinds of things on. And Roger's got a big facility outside.
How would the school system feel about promoting that just, when school's not going on? Because I know you don't always want a lot of random people up there.
That's true. Lots of times our community people will use our schools. I know we've opened up our buildings lots of times for basketball, for the local guys to come out and play. We've opened it up lots of times. We have one of our assistant principals at our high school, Sam Dunn. He will open up the middle school and have
mm-hmm.
walking for adults. Back in the winter, he did that 2 nights a week, I think, in fact.
Mm-hmm. So that might be a possibility for encouraging.
Yes.
I'm trying to find ways to get families to do things together.
Yes.
And when I was up there, I thought, wow, this would be a very cool place for families to come because mm-hmm. the kids, younger children could play on a little playground and parents actually could walk around a little bit and still be...
Have you noticed that we also have 2 community parks now?
Yes.
One is up on the hill there at our Head Start building, and the other is downtown,
mm-hmm.
and they have walking areas there for the public.
Mm-hmm.
It's been built in the last few years.
And do you see them getting used very much?
Not as much as we'd like.
Yeah, yeah. So maybe one of the things is
Promotion, I
promoting
think, is the
activities
key.
and things. You know, sometimes I always tell people, you know, it's not always true that if you build it, people will come.
You've got to promote.
You have to promote it,
Okay.
you know,
Promote
in
it.
some ways,
Yes.
you know, so that and people get in the habit. You know, once they get that routine started, then they may start doing
Same
it.
with myself. You know, I there for a while I was walking like 2 miles a day, and you know, you kind of get out of that routine, and it's hard to get back in.
Yes, yeah, and making time. You know,
Yes, yes,
that
yes,
time is always a problem. Do you have much success in this community working with the families of children who are at risk for learning problems or in, you know, health risks?
Well, you know, our family resource ladies work very hard in trying to get our parents out. We've also noticed that if you feed them, we get more to come out if they are fed. And again, that comes back on the district as funding. Funding is a major issue on everything anymore. We have encouraged our parents to come out, but we haven't had as much success as we'd like.
So what's the best way to get that information out into the community?
Well, we have something at our district called One Call, and our community uses that frequently. You know, if there's going to be a walk-a-thon or something for the community, it will get broadcast across our One Call. Also, we put.
And does that just go to the children at school, or how does that work?
It does. Yes.
But it doesn't directly get to parents.
Yes, it goes to their homes.
Okay, all right.
It goes to parents' homes.
Okay.
So you have, you know, the school system is pretty big compared to everything else, you know.
Right.
Grandparents, sometimes names are on that One Call, aunts, uncles, not just parents. It's whoever
Okay, so a lot
the
of
parent
people
puts as a call person on there.
Would it be, and I understand now that you probably have used this for just announcing events. Is that mainly what you've used it for?
Yes, for our district, as our school district, you know, if there's going to be a baseball game tonight, then we'll put it out to the parents. You know, if there's open house tonight at the middle school folks will call parents and say, you know, we're having open house tonight. Yes, it's very effective.
Have you ever tried to, or would it be a possibility to consider using it for as an informational source? In other words, teaching people, you know, for instance, diabetes is called sugar.
Yes.
And in much of this region. And so with that thinking, a lot of people think, well, as long as I don't eat a lot of sugar, I'll not get that disease.
Don't know that spaghetti is one of the worst things.
Yes. Yeah. So could it be that you could give just brief little health messages or something like that through
That
that
could
system?
that could be done. The only problem sometimes when there is so much information coming home, the parents complain, you know, that we're getting too much One Call coming to our homes. But yeah, that could happen.
And of course, you only get the complaints from the few that are
Yeah,
really
that's true.
put out.
That's true.
I know how that works. 99 people can be happy with it, but
And
the
then
one
you
that's
got
unhappy
one
is the one that calls.
Yes.
Yeah. So, okay, going back to the idea of diabetes, you know, we're trying to think about how to create an awareness in the people of the community. First, that there's a problem.
Yes.
And then that they can do something about it. So I'd be really interested in what ideas you might have.
Well, again, you know, like I say, I think knowing the facts is teaching them from the school level. But also, I would like to see, you know, more community involvement, you know, where it be our doctors, where it be our health people from the health department and other organizations, you know, that gets messages out there how important it is if you have diabetes, what you have to do to maintain a healthy lifestyle. Maybe some more support groups, maybe even sometimes, you know, if we could get it in our churches even.
Say a little bit more about that. How would we go about?
Well, lots of times, you know, there's always a benevolence committee or something at a church that, you know, does a few things like that. And maybe those people could work in conjunction with, you know, our doctors and our health support people and have maybe a monthly information type of meeting that, you know, taking care of your body, if you have diabetes or obesity issues, just, numerous health issues that could be discussed maybe after the Wednesday night church service or something.
Do you attend the church regularly?
Yes, I do.
And in your church, are there folks that have diabetes?
I don't know of anyone in our church that has diabetes.
Okay.
But I know there are several that we could sure use some lessons on obesity and eating healthier and exercising more.
One of the things that I've noticed is that people talk about cancer, but they don't always talk about diabetes when they have it.
Yes.
I don't know, do you hear people talking about diabetes at all in the community? Or?
Really, I hear as much about it, I guess, as I do cancer, but that's because I'm out and about, I guess, than most folks are.
Yeah. Well, and it's getting, I'm very interested in this idea of using churches a little bit more because there's facilities there. There's a local congregation, and they're kind of rooted to different places.
And they're all over our district.
Yes. And so if you wanted to go and engage them, how would you go about doing that?
Well, first of all, I think there would probably need to be some type of committee set up that got out there and, called the minister or whoever's over that particular church, if there's another assistant minister or something other, and say, we have this to offer. Would you be interested in bringing it out to your church on Wednesday night or whatever day was convenient? I think you could reach a lot of people through the church organizations.
Okay. That's kind of what I'm thinking, too, that might be the best vehicle in these rural communities.
Yes.
So now I want to bring up one touchy subject, and that's tobacco. And I know that a lot of Kentucky counties have been tobacco growing places, and so I wonder what your thoughts are about tobacco and tobacco use in the county.
I'm strictly against smoking. I have some family members that smoke, and I stay on to them all the time. Please don't do that. I think I think I lost my dad to that. He failed to see it before it's too late. He had COPD. Of course, he also worked in coal mines in his younger years. But I really think tobacco was a contributing factor to causing him to have COPD. And we see a lot of people that have COPD. And it's sad to watch that person literally waste away from coughing and chronic bronchitis and emphysema and all the stuff that goes along with it and all that.
Do you have any ordinances or about tobacco use in the county?
Yeah, some of our restaurants.
I noticed this is a smoke-free facility.
Yes, it is. The courthouse is supposed to be smoke-free. There's several restaurants here in town that are smoke-free, and there's some that are not. I'd like to see them all smoke-free because when I go to a restaurant to sit down and have a meal, I don't like smelling smoke when I leave, and I don't like breathing it. I have asthma, and I have,
asthma's a big problem too with a lot of children, particularly. Yeah. People don't take too highly to changing the rules though around tobacco, do they?
Especially the older generation. Well, I guess some of the younger ones too.
Yeah.
We have a lot of programs in our schools, that talk what will happen to you if you smoke. Cost is a big factor. I think they're very expensive now, I'm sure.
Yeah, and if you're having trouble paying your bills.
Yeah, but I also notice that some of our parents, they're having problems paying their bills, but yet, they have cigarettes.
Yeah, kind of wonder about that.
Yeah, you wonder, what are you placing first, your child or your cravings for that nicotine?
Yeah. Well, you've been really helpful. You've given me lots of information. One other thing, let me just ask one more thing. You have a coordinated school health program?
Meaning?
A committee in each of the schools to focus on wellness, particularly around the teachers and moving out towards the students and the community.
Our family resource directors usually take care of that, or our PTO. Our elementary schools have a very good functioning PTO. They work with lots of things too.
So would PTO groups, you think, be open to doing some things about promoting health with children?
Definitely. We have,
would that be a good vehicle?
Elementary. You know, we have some wonderful PTO gals that works very hard in our school systems.
Okay, that's good information too. I think part of the problem is we all try to do things in the old traditional ways, and some of those traditional ways aren't getting us very far. And the other thing I see so much in rural communities is it's the same people on every committee, and they're working themselves to death.
They are. It's hard to get people in committees.
Yeah, so finding ways to work smarter and reach out differently is kind of what we're looking at, how we can. We have 4 more years on this grant, so it's a real possibility of at least instituting some things that might become policy or, really be real change. It's not about just taking care of a person with diabetes. It's really about figuring out ways we can spread the word and move towards prevention. So if you have any ideas about that after we talk today and in the future, get with Linda, and she knows how to find me.
Okay.
And I'm here in the county, and we'd like to work with you as much as possible.
Well, we're here to work in any way we can to promote.
The coalition is actually working right now on deciding what goals they want to focus on in the community. So once they've decided on what they want, we may be coming to you as the school from the school perspective and saying, how can we do this?
Yes.
How can we work together to make this happen?
Right.
So that would be really valuable help.
I'm willing to do anything you can.
I got you on tape now.
Okay.